Hello, my dear friends. I'm Dr. Arun Swami. So let's again welcome to all of you on my this YouTube channel. In this video, we are going to be discuss about that Brodie's abscess and versus Psoas abscess, because these two abscess conditions, they are very frequently asked in various examination, and this basically gives a lot of trouble to remember and to make a proper diagnosis. So we are going to be discuss about this both abscess condition, Brodie's and the Psoas in this video. So let's begin. So first of all, I would say to all of you that please try to solve this MCQ. A 13-year-old boy presents with dull aching pain in upper leg for 4 months. Pain is worse at night and partially relieved by the analgesics. There is no fever or systemic illness. X-ray reveals a well-defined lytic lesion with surrounding sclerosis in proximal tibia metaphysis, and most likely diagnosis is. So this is A. Osteosarcoma, osteoma, Brodie's abscess, and Ewing sarcoma. So guys, I would like to let you know that how you can approach such MCQs while you are getting in the paper, whether it is the FMGE or whether it is the NEET PG or any other MCQ paper, how you have to do your approach. Guys, the one thing you should remember in the orthopedic, that the age of the patient is the first hallmark sign. That is the first hallmark sign to understand that what is the diagnosis of the patient. So first you should focus on the age of the patient, that is 13-year-old. So whether it is child, whether it is adolescent, whether it is young adult, or whether it is the senile age group, right? So first you should focus on the age of the patient. Number two, you should focus on the condition, the symptom which is given. The what is the symptom is actually that's telling into the MCQ. So these are the symptoms which is actually giving or given at the MCQ level. So guys, the next thing you should focus on, what are the radiological signs you are actually seeing on the radiological picture. So this is how the criteria makes the probable diagnosis for anything in the orthopedic part. Guys, now let's start talking about the Brodie's abscess, and later we'll discuss one by one these such practice MCQ, that how you should go with the approach, and how you can easily answer any such MCQs. Now let's talk about first of all the Brodie's abscess. So the definition, if we talk about the Brodie's abscess, that this is the localized form of the subacute osteomyelitis. So we know that subacute osteomyelitis, that is a type of a infection condition, and we know about the osteomyelitis, that is the three type: acute, subacute, and the chronic condition. On the basis of the time duration, we have classified them into the acute, subacute, and the chronic. So this is the definition of this Brodie's abscess, that this is the condition which actually happening into the subacute osteomyelitis condition, and basically there is an abscess formation in the bone. Now you should focus what is the area where this abscess is actually forming into the bone. So we know in the bones there is the epiphysis, metaphysis, and the diaphysis area. So this Brodie's abscess is mostly found in the metaphysis of the long bones, right? So you can see over here in this picture that this is the bone which is given over here, and in this bone, that this upper part we called as epiphysis, and down part, this area we called as metaphysis, and below this part we called as diaphysis. So this is how your bone is actually described. Now you can see over here, there is the lesion which is present into this area, and guys, this area, this is which area? That is your metaphysis area, right? So this is your metaphysis area. So this is the definition of your Brodie's abscess. What is the common site? That is mostly it found in the upper tibia region. That is the most common site, but it could be found in any area inside the body, like the femur or the hand or anywhere else, right? And the common organism which is actually causing this abscess, that is Staphylococcus aureus, right? Staphylococcus aureus. Now, what is the pathology of this condition? There is actually the low grade infection which leads to the localized pus collection. You can see over here, यहाँ पे pus भरा हुआ है बेटा. So this is the localized pus collection in the bone. एक bone के अंदर पे एक झील बन गई basically, that is actually the collected into the form of the pus, and guys, there is surrounding area, there is a new bone formation is actually happening, and that we called as the sclerosis part, right? What we call this sclerosis part. So you can see over here inside of this X-ray, you can see this is completely the pus area surrounded by this white white coat over here. This is we called as sclerosis part, right? Sclerosis part, and this is the classical hallmark sign for Brodie's abscess on the X-ray. So in X-ray, if the MCQ is saying there is a lytic lesion surrounded by the sclerosis part, right? That is the classical hallmark for the Brodie's abscess, right? So this thing you have to remember for MCQ purpose, that there is a lytic lesion surrounded by the sclerosis part, that is classical appearance for the Brodie's abscess, right? Now what will the clinical feature? If we'll talk about the clinical feature, the clinical feature of the Brodie's abscess will be, there will be the chronic localized bone pain, right? And this is the dull aching pain, right? This is not the sharp pain, this is the dull aching pain that was at night, that is very, very important, guys, because the another condition where the pain was at night, that is your osteoid osteoma, that is a benign condition of bone tumor, right? So this is how this pain is actually happens at the worst at night, and there is a mild swelling, and usually there is no high fever, can be seen, or there can be mild fever can be seen, right? Remember, guys, the one thing about the Brodie's abscess, there is the pain, area is metaphyseal, and lesion, that is sclerosis, lytic lesion with surrounding by the sclerosis. If you find this condition, clear-cut answer, that is Brodie's abscess, right? So differential diagnosis you have to be made by the osteoid osteoma. Guys, the one thing you should remember, in osteoid osteoma, the pain is easily relieved by the NSAIDs, anti-inflammatory drugs, right? NSAIDs. But in Brodie's abscess, pain cannot be relieved from the NSAID, right? So this is the makes the hallmark diagnosis for the Brodie's abscess. Now comes to the investigation part. The MRI is remain the best method to identify this Brodie's abscess, and in the MRI you will see there is a Numra sign, right? Numra sign. So Numra sign you can see on the MRI in Brodie's abscess, and on X-ray there is radiolucent cavity with surrounding sclerosis part. Talking about the treatment, if this is the abscess, what you have to do in abscess? Give first of all the antibiotic to kill the bacteria, organism. And number two, what is the abscess is there? You have to take it out, like from the in the form of curettage. So there is the curettage, and if there is a bone loss is big, you have to do the bone grafting. So you can see over here in this picture, there is the curettage is going up, and there can be bone grafting plus minus. If it depends upon the surgeon choice, if there is a bone loss is more, the bone grafting can be done, or either they cannot be done, right? So this is all about the Brodie's abscess. Now let's come on the Psoas abscess. The Psoas abscess, the definition of Psoas abscess is that this is basically the name is telling about the Psoas abscess, means the psoas muscle. We know the psoas muscle, that is the psoas muscle which is present into over this area, that is at the downside area, abdomen to hip area, that is your psoas muscle. And whenever on this muscle area, on the superficial area or within inside the muscle area, any abscess collection happens, this is we called as psoas abscess, right? तो आपको इसके नाम से पहचान जाना है बेटा. Psoas abscess means the abscess either on or inside the psoas muscle, that is your psoas abscess, right? So you can see over here that this is your 12th rib, this is the 12th rib, and this is your psoas major muscle, right? Psoas major muscle, and you can see it start from here, and basically it's going downside and going to be attached or insert at the femur area. Guys, you can see over here, this psoas muscle is passing through the hip area as well, and whenever any abscess collection happens around sound or on this psoas muscle, guys, this actually looks something like this, and this is your psoas abscess. Guys, there are some clinical findings and very, very hallmark signs are there about this psoas abscess. You can see over here that this psoas abscess can be two types, that is number one is primary psoas abscess and another one is secondary psoas abscess. So the primary psoas abscess, the main cause of primary psoas abscess, that is your hematogenous spread. So from the blood, any bacteria that can reach up to this psoas muscle and start accumulating over here and start leading to the inflammation, we called as a hematogenous spread, and this type of psoas abscess we called as primary psoas abscess. And the common organism again remain Staph aureus, right? Staph aureus. देखिए मोस्ट कॉमन एरिया पे ना आपको एक चीज याद रखनी है, द मोस्ट कॉमन ऑर्गेनिज्म कितनी भी जितनी भी एब्सेस इनमें जो हो रही है मोस्टली दे डन बाय द स्टेफ ऑरियस बिकॉज ऑन ओवर स्किन विच कॉमन बैक्टीरिया वी आर हैविंग द Staph aureus, right? Staph aureus. Okay. In secondary psoas abscess, it is basically occurs due to spread from the nearby structure. So this is the secondary type. Means this is not the directly bacteria reaching over there. Bacteria पहले कहीं और पहुंचा और वहां पहुंच के और फिर psoas के ऊपर पहुंचा. So we called as secondary psoas abscess. And the most common bacteria that can cause this psoas abscess, that is your TB, right? Mycobacterium tuberculosis. First, TB bacteria is actually reach into the lungs. Then from the lungs, it is spread into the spine. And now from the spine, it may reach into the psoas area and can lead to the psoas abscess. So in India, the TB spine that we also call as the Pott's disease, guys, Pott's disease, that is the most common cause of the secondary psoas abscess. Another reasons are like Crohn's disease, appendicitis, and the vertebral osteomyelitis, right? Vertebral osteomyelitis. So these are the common regions of your secondary psoas abscess. Secondary psoas abscess. Now, what will be the clinical feature? The classical triad of the psoas abscess will be there is fever, back flank pain, and there will be the limping or difficulty in the walking, right? Guys, please pay attention. This is the classical triad of the psoas abscess: fever, back or the flank pain, and the limping and difficulty in walking. And the classical sign that when the person with the psoas abscess comes to the hospital, guys, this person will try to keep the hip into the flexion. Why? Because when you are doing in the extension of the hip, the muscle is going to be stretched up. Muscle is going to be stretched up, and if there is any abscess collection over there, muscle will give you the intense pain condition, very severe pain condition. भाई अगर आप इस मसल को बिल्कुल स्ट्रेच करोगे तो definitely muscle will not try to stretch up, and on the stretching of this muscle will give you the severe pain condition. So that's why when the person comes to the hospital, वो अपने हिप को कैसे रखेगा बेटा? फ्लेक्शन के अंदर रखेगा, and this flexion will lead to the relaxation of the psoas muscle, and person will have the less pain condition, right? So this is the classical sign. This is the classical sign for the psoas abscess. Hip kept in flex position, right? Kept in flex position. So you can see over here, this is the area and this is the area. This is how you can see that this is in the flexion condition. This is how in the flexion condition, and whenever you will try to extend this area, whenever you will try to extend, because ये यहाँ पर होएगा, and guys, whenever you try to extend this hip like this psoas muscle will be stretched up, and this will give the intense pain over here. So this is the classical hallmark sign for the psoas abscess, right? And this is we called as on the passive extension. On the passive extension on the hip area will give the intense pain on this hip area. Guys, this is we called as positive psoas sign. What we call this? Positive psoas sign. And the investigation remains same. That is the CT scan, MRI, and in TB spine you have to see there is the vertebral destruction, cold abscess, and there can be the psoas tracking, right? So in TB spine, this all thing you can see. Treatment again remain the same. If there is a TB condition, you have to start the ATT according to the regime, or if there is no TB, only the Staph aureus condition, then you have to give the only antibiotic. And drainage, if there is a large abscess is there, right? So if abscess is there, IND is the best choice to drain this area, right? Now, remember few things about this Brodie's abscess and the psoas abscess. So just now we discussed Brodie's abscess is the condition of subacute osteomyelitis, but psoas, this is the psoas abscess is the abscess on the muscles of psoas muscle, right? The common site of the Brodie's abscess, that is the metaphysis, and the psoas abscess, that is at the psoas muscle. Organism in Brodie's that is most common is Staph aureus, but in India the psoas abscess for primary that is Staph aureus, for secondary psoas that is the TB. The Brodie's abscess will show you the night pain basically, and the psoas abscess will show you the pain on the hip extension condition, right? Hip extension condition, you will see the pain over there, right? Now, this is not the flexion, on the extension, hip extension, there can be the pain. Now, the best imaging for the Brodie's, that is the MRI, and for psoas it could be CT or MRI both. So now come to the MCQ part. So now please read once again this MCQ. A 13-year-old boy present with dull aching pain in the upper leg for 4 months. Pain is worse at night and partially relieved by the analgesic. There is no fever or systemic illness. X-ray reveals a well-defined lytic lesion with surrounding sclerosis in proximal tibia metaphysis. Most likely diagnosis. So guys, the first thing you should check: area, metaphysis, long bone, short bone. TB is the long bone, so that is the long bone metaphysis. Another thing, guys, initially it is showing that pain is worse at night and partially relieved by the analgesic, right? Partially relieved by the analgesic. So guys, we know that at night pain can be occurring in two conditions: osteoid osteoma and the psoas abscess. So might be it could be two, right? So this osteosarcoma ruled out. Having sarcoma, this happens at the diaphysis area, so this is also ruled out. Now we remain left with only the two options, that is osteoid osteoma and Brodie's abscess. Guys, please pay attention over here, that you please see the clinical hallmark sign, whether you can see for the Brodie's abscess or not on X-ray. And here you can see clearly, well explained in the MCQ, that on X-ray there is a well-defined lytic lesion with surrounding sclerosis part, right? And this will give us the best diagnosis for this condition, that is your Brodie's abscess, right? Brodie's abscess. Coming to the next MCQ, a 35-year-old man present with the chronic back pain, low-grade fever, weight loss and difficulty walking. Examination shows hip maintained in the flexion and pain on extension. MRI demonstrates lumbar vertebral destruction with psoas collection. Most likely underlying cause. Guys, you can see over here, chronic back pain, weight loss, low-grade fever and difficulty in walking. Guys, this weight loss condition, this could be occurs in the TB condition, right? In TB, we know. And we know that TB spine is not the aggressive condition. This happens very slowly. And that's why in the TB spine, you always see the cold abscess, isn't it? Cold abscess. So this is not the highly progressive condition, that is slowly progressive condition of the TB spine. That is how you can see there is a low-grade fever, there could be the weight loss, there could be a chronic back pain, and obviously there could be difficult walking, right? Now the examination is clearly mentioning that hip is maintained in the flexion condition and pain on extension. Guys, pain on extension, it means that this is suggestive of something like the psoas condition, right? Psoas muscle. MRI demonstrate lumbar vertebral destruction with psoas collection. So this is a type of secondary psoas abscess. Secondary psoas abscess, most underlying cause. And secondary psoas abscess in India, the most common cause is tuberculous spine, that is the Pott's disease, right? Pott's disease. Guys, please pay attention. In septic arthritis, pain could have in all range of motion of the hip, not only in the flexion or the not only in the extension. It could be happens in the flexion, extension, external rotation, internal rotation. Every condition in septic arthritis of the hip, you can see the pain, right? Pain condition. Now, in septic arthritis, it could be the aggressive condition. There could be a high-grade fever. All of this condition can be occur. So there is low-grade fever is mentioning in the MCQ. So this is not the septic arthritis condition. Now, coming to the next MCQ, a 15-year-old boy present with the persistent tibial pain. MRI suggests subacute osteomyelitis. Which anatomical localization is most commonly involved in the Brodie's abscess? So you can see the diagnosis is already given. That is the Brodie's abscess, which is the condition of subacute osteomyelitis. And this is the tibial pain. And we know that Brodie's abscess mainly happens at the metaphysis area of the long bones. So the right answer of this MCQ, that is metaphysis of the long bones. So this is how you can make the proper approach in any kind of MCQ about the Brodie's and the psoas abscess. So if you like this video, kindly like and share and do subscribe this channel. And please always watch this channel for similar like videos to understand and to make a proper concept about the small things which gives you a lot of difficulty to understand in many ways, right? So this is all about for this video. That is all from my side, guys. Thank you very much.